So I want to thank our panel this morning for giving us your time and your wisdom and your energy. And I want to invite each of you to please tell us something about your experience with kids and families and their mental health before and throughout this pandemic. Are you noticing any trends or shifts that you're seeing among your patients and their families at this time? And anybody can start.
Okay, I'll jump in. I think we have a pandemic of mental health problems that we're seeing here, around the country, and around the world. We'll talk about this more in detail, but in terms of sleep, anxiety, depression, and now as we get to COVID 3.0, a kind of sense of just malaise and giving up. And it's just across the board.
Thank you, Steve.
I'll second what Steve has said. So I've spent a whole career doing a lot of mental health work for my patients in terms of managing anxiety and depression and eating disorders. And I have never been as busy at doing that as I have in the last 2 years. I think it now represents probably about 20 to 25% of all of my visits involve treating mental health disease.
Wow, Eleanor, thank you. Mark, Sabrina.
So I think my perspective is a little bit different because I work in an acute care setting in the hospital. I don't have like a panel of patients that I see. And so we're going to talk more about this later, but I think sort of my experience over the last couple of years has been related to the increased number of kids who are being sent in by their doctors, by their schools, sort of for crisis evaluations and, increased risk of suicidality and things like that. And that's definitely gone up. It was already kind of out of control problem we had in the ER, but over the last 2 years, it's just exponentially increased.
Sabrina, thank you.
So I'm Mark Poznanski. I'm an infectious diseases physician at Mass General working with adult patients. And I also am involved in vaccine development, but obviously see things at the micro level, which is within my own extended family. And family, I have 2 children, a 15-year-old at high school in Boston and a 19-year-old in college at Tel Aviv University. And then ramified through all of that are all of their friends and advising on school programs and so forth. And I definitely can see that mental health at this point is a very significant issue that previously it was all the practicalities of mask wearing and vaccines and washing your hands and stuff like that. But that is now blended into a rising tide of the mental health issues. And I'll just end this piece of the thing that my son came back with after he went to camp. He went to Camp Yavna, and he said he was amazed when kids were sort of in an open forum talking about what their experience of the pandemic had been, where the top issue was anxiety and depression. And for him, he was amazed that consistency of message from children talking to each other about what the challenge of the pandemic had been, or was, and continuing.
Wow, thank you so much. The big question that I have sort of before we even jump in, each of you are such experts in your field, and I wanted to ask, we're talking about mental health, but what is mental health? How do we recognize the signs of mental health problems or anxiety in our children? And do you have any metrics that we might use or be looking for that could help us to recognize signs of problems?
Okay, I'll jump in on that one. First of all, it's a great question to reflect on what is mental health. And in fact, I would throw that back to people who have kids who are tweens or high school kids. I think it would be a great discussion to ask them about. But from my perspective, it's being able to function in major life areas. Specifically for kids, it's school, because school school is their work, right? For adults, we would say it's work, but for kids at school, another aspect is to be able to maintain their own physical health and healthy feelings about their body. Of course, there's a social interpersonal aspect to get along with peers and their family. And another aspect is self-regulation, to be able to manage effectively their thoughts, feelings, and behaviors. One other aspect that I think is important is to be able to love others and to be able to accept love from others. Certainly a Jewish concept is to have a balance between self-regard and regard for others. Two other ideas: sustaining effort towards actively achieving one's goals, whatever those are. And then perhaps last, to be able to use one's cognitive abilities in an effective way. So,
Yeah. And so what are some of the signs that somebody might be off track on that?
So taking the lead, talking about depression and anxiety, since these are the big ones that people are seeing, primary symptoms of depression are not unlike that with adults, of feelings of sadness, feelings of hopelessness, mood changes. Most kids who have significant depression are going to have noticeable changes in social activities, loss of interest in school, poor school performance, and change in appearance. Now, I'm saying that with an asterisk because so many kids are feeling that who don't, let's say, perhaps are not diagnosable, but we want to watch that. Specific symptoms might be extra crankiness or anger, continuous sadness, hopelessness, a social withdrawal from their friends and family, a sensitivity to criticism, appetite changes, either well up or well down, sleep significantly up or down, low energy, concentration problems, especially with younger kids, physical problems such as stomach aches or headaches that don't seem to get better with treatment. Of course, thoughts about death and suicide, and substance abuse, or social isolation, and other kinds of behaviors that are problematic or getting them in trouble.
Thank you, Steve. Yeah, I'm listening to that list and I'm thinking to myself, wow, that's a big list. Eleanor, what are you seeing amongst your patients? How can you help us to think through how we understand both mental health and mental health challenges among our kids and how we might be able to help them?
Yeah, so I think Steve's right. We've seen a tremendous increase in anxiety and depression, and eating disorders is the other one that I would put on there. I think, it's important to know that anxiety and depression often in kids and adolescents sort of work as a seesaw. So sometimes a child is very anxious, but very functional, right? Going to school, doing all their things, but it's taking a tremendous amount of energy to sort of run the machine because they're so anxious. Sometimes when the anxiety is lower, you see more of the sort of negative mood symptoms. And that's a very common sort of dichotomy. I think I'm going to have a very brief rabbinic detour here for a story. 2 years ago, a very lovely 11-year-old-ish patient of mine developed, as kids that age often do, a lot of anxiety about throwing up in school and getting sick in school, which is a very common one. And we got her engaged with a great therapist. And they talked about, as we often talk about, what is reality and what are your anxious thoughts? And your anxious thoughts are about, throwing up. And this very well-read 11-year-old said to the therapist, I'm also very worried about this virus that's popped up in China, and I'm afraid it's going to come here and ruin everybody's life, and I'm going to get sick, and everybody's going to get sick, and it's going to be like the end of the world as we know it. And the therapist said to her, well, that's a great example of your anxious thoughts, right? That's not reality. Those are your anxious thoughts. And we have to learn some, tools to put those anxious thoughts away. Needless to say, I needed to find that child a new therapist 6 months later. So here's the thing for this whole generation of kids, the things that used to be their anxious thoughts, a virus is going to come and ruin my life. I might never get to go to kindergarten. I'm not going to go to camp. I might have to spend my first semester of college living in your basement. I might graduate from college and have to live in your attic, right? All those things came true. And so if what used to be your anxious thoughts become your reality, you lose your calibration of sort of what's right and what's anxious. So now how am I supposed to make a decision about whether or not I really need to check my backpack 5 times or once is enough? Because everything that was my worst anxious nightmare turned out to be reality, right? So that's where we are now. And I think part of the job of parents and pediatricians and teachers is to figure out who's having sort of this normal reaction to the pandemic of anxiety and depression, and to normalize those feelings for them and to say to them, you're right, this is terrible. And I'm really sorry that this is happening to you. And you're right. There is very little joy right now. And, I'm sorry. And who is really struggling and needs more support in the way of therapy and or medicine? That's the trick here. And I think what I would say is you really are looking for changes, right? So changes in attitude, changes in joy, changes in sleep, changes in behavior. For eating disorders, changes in wardrobe, right? If you've not seen your child outside of really bulky sweatshirts for 6 months, you should ask yourself, what do they look like under that sweatshirt? And I think you don't need to make the diagnosis, right? It's not your job to necessarily figure out whether your kid is sort of in this normal unhappy or truly anxious or depressed. But what you want to do is extend the offer to your child and just say to your child, hey, you know what? It seems like something's going on with you. And I don't know what it is, but I'm here if you want to talk about it. And I really think we should make an appointment to go see, Dr. X and try to figure out what's going on with you so that we can help you. And that's the important thing. And you know what? You might bring them in to see me and we might decide together that there's actually really nothing wrong. And that's totally fine. But we might decide there is something wrong and we can do something to help. But, we can't do anything about problems we don't know about. So the first step is to sort of say to your child, and I'm going to just say, I include children for pediatricians, it goes up to like 25-ish, to say to that person, hey, it seems like you're struggling. Let's see what we can do to help you.
That is just so extraordinarily helpful. And I want to follow up by asking, we've been hearing some really scary statistics. Just throw out one, according to the American Psychology Association, from March 2020 until October 2020, mental health related emergency room visits increased 24% for children's ages 5 to 11 and 31% for those ages 12 to 17 compared with previous emergency room visits. And NPR reports that 1 in 3 high school students has reported feelings of hopelessness, and suicide rates have gone up just an extraordinary amount among 10 to 24-year-olds. There are varying statistics, but one of the ones bandied about is 57% up. Can you share with us how you're seeing these statistics reflected in your work day to day? And as you're seeing them, how might we deal with them both as individuals and as a society?
So currently I work at a community hospital where we see patients in the ER as part of our, one of the jobs that we fill at the hospital. And I can confirm that this is 1,000% true. I worked in the ER at Boston Children's Hospital for a really long time, and we always had psych patients in the ER, but nothing like what we've been seeing in the last couple of years. I will say that it has ebbed and flowed, and, you know, has been a little bit better since kids have been back in school, but we, you know, every shift have kids that are being sent into the hospital, like I said, by their doctors, by their schools, because, you know, someone sent a text to a friend and the friend reported it to the guidance counselor, and then the guidance counselor sends them to the ER for a crisis evaluation. These statistics are 100% accurate. We're seeing it in younger kids, 9, 10, 11-year-olds are coming into the ER for this. So it's definitely a reality. I'm going to address a little bit, I think, one of the questions in the Q&A about psych patients and admissions. And I will say that ER capacity is definitely affected by psychiatric patients, but for the most part, these patients don't generally get admitted to medical beds. So any statistics we're seeing about full hospitals and inability to appropriately care for kids that need to be admitted to the hospital is not necessarily affected as much by psych patients. That ER wait times 100% are, and ER capacity most definitely is, because it takes time to find a psych bed for a child, because we don't have the capacity that we need in this state, and we're a lot better off than a lot of other states. And so, you know, I think that that's definitely a reality. The statistics are 100% true.
And Sabrina, can I follow that up? And one of the things that I just heard you say was that now that children are back at school, you're seeing less of that. Does that seem to lead you? One of the questions we have in the chat is about sort of societal responses to COVID. And are you seeing any metrics within the emergency room that would lead you in one direction or another in terms of mitigating physical and emotional health?
So I will say that this is 100% anecdotal, and I don't have statistics, and I don't work every single day. So I can't say with 100% certainty that the numbers were this and now they're this. What I can say is that in like that last year, especially in the first half of the year, we were seeing a lot of kids who were coming in who had never had any mental health problems, who, you know, their story was, I can't go to school, and I can't see my friends, and I can't play hockey, and I can't do this, and my grades are slipping. And it was just sort of this, that was like the common themes that were being repeated. And so I think now that some of that is allowed, or that they're able to more fully participate in their regular activities, a little bit of that has been taken out of the equation. There's still so much that's wrong. So I do think that there is a balance. I don't necessarily think we need to completely forego all mitigation measures. You know, I think that there's a middle ground, but I do think that there has been some improvement, and that letting kids, and not letting is the wrong word, but kids being able to go out and socialize, like Steve was saying, like that's what kids do. They go to school, they see their friends, right? And I think that's a huge part of adolescent development is, you know, socialization with their peers.
Eleanor, could you jump in?
Yeah, but one thing I think it's important to remember is that, you know, again, sort of in response to the Q&A, is that even if Mark could solve all of the problems and make COVID go away with a snap of his finger, right? It's important to understand that that would not end the mental health crisis for our children and adolescents. So I think you have to understand what's happened over the last 2 years as sort of a generational trauma, like the way people who went through the Great Depression had sort of a generational trauma. And trauma, you know, as Steve would tell us, is the gift that keeps on giving. So just when the trauma is over does not mean that the mental health trickle down somehow goes away. So I think we have to understand that, and it's important as restrictions lift, and this was the case last summer also, to understand that even as things get better, it doesn't mean the mental health stuff all goes away, right? And mental health, anxiety in particular, are patterned behaviors. And so when patterned behaviors have become ingrained over 2 years, even if the trigger goes away, the pattern doesn't necessarily go away. You know, I think what Sabrina sees on the inpatient side, we also see on the outpatient side. So as I said in the intro, I'm spending increasing amounts of my time managing anxiety, depression, and eating disorders and helping people navigate the outpatient mental health system, which is really, really strained. So anybody who's looked for a therapist in the last 2 years knows that there's usually a month of waiting list and lots of negotiation and looking and searching. But, I think there is help out there. People need to really enlist the help of their primary care doctors in navigating this system.
If you, to double ditto what Sabrina and Eleanor said, when we look at the numbers rising or the percentage increase, they were high already for a decade. When you look at things of increased loneliness, increased self-harm, increased suicidal behaviors. So we could have had this panel 3 years ago, and we would be saying a number of these same concerns. So there's a double asterisk or exclamation points on what people are saying.
And sorry.
Please, Sabrina.
I just wanted to quickly address an ongoing comment in the Q&A. Just to remind, the scope of this panel is to discuss mental health. There are plenty of long-term COVID consequences in kids that we don't even have the time, scope, or data to discuss right now. So just because we're focusing on mental health in this panel, it does not mean that any of us minimize the effects on kids of actually getting COVID. And we'll talk more about that, I think, later on, just so that we can sort of put that to rest a little bit.
Yeah, I actually think I'd love to jump to that right away and sort of come off a plan for a moment, because Mark, you had mentioned some of the challenges that you're seeing physically among kids who have gotten COVID as they're recovering from it.
Yes, so we have to face facts about the medicine of all of this, that we are actually learning about a new condition as it's evolving over the last 2 years, how it presents. And if we can all remember back to 2 years ago, when it seemed like it was a standard respiratory tract infection, and bit by bit, it's had additional complicated things, including the fact loss of taste, loss of smell, which has impact on how people choose their food and eat, all the way to the depression and anxiety that we're seeing, and the brain fog and other neuropsychiatric aspects of the longer term disease. And even the idea that there is long COVID, which is now pretty much settled into the scientific and medical community. I don't think any of us 2 years ago, even Eleanor's 11-year-old child, who was obviously visionary in this area, realized that we were in for a completely different type of infection that we'd ever seen before, in terms of a respiratory virus causing longer effects, including neurological and psychological effects. So I think that's tough for children to take on board. It's even probably tougher for adults to understand where we are now in the pandemic, that we're actually thinking about that.
So I'm hearing there are dangers if we get COVID, and there are dangers if we don't get COVID. And
Right.
we're in this time that Eleanor, you so beautifully framed with your initial story about how do we know which anxieties are the right ones to have. And Mark.
And Michelle, I really want to make this point, because it's both, a student of the history of medicine, and I'm very fascinated by catching an infectious disease has never been considered a good thing throughout human history. It's never been like, oh, let's, just get it. There has never been a time when that was considered to be like the optimal thing. And consequently, in the context of COVID, which remains, elements of it are unknown to us in terms of even its short, let alone its long-term consequences, that we must continue to avoid getting infectious diseases. It's never been like a great successful human civilization story that people went out en masse and got infectious diseases. The fact that we now in 2022 can prevent them with vaccines and other means is an advance of civilization, not a descent into a regression of our civilization.
And following up on Mark, one thing, especially in terms of history that I'm concerned about, because I think we are going to see more and more long-term COVID, is the reaction of people to that, which it could go along the way that to go way back with Agent Orange, when soldiers began to describe that, or fibromyalgia, et cetera, and other people, right, including in the scientific medical community, doubted it. And I have a sense that that's what's going to happen here. So I'm already seeing adults applying for disability, for example, with long-term COVID symptoms. And I think we're going to have a kind of stigma or negative reaction that these are people who are just trying to milk the system.
Wow. So I've got all these reasons. I'm feeling very anxious listening to you here. And as a parent, as I'm trying to make decisions for my kid, if I'm a parent or a grandparent, can you talk to us about, how do parents, caregivers, and grandparents weigh the choices between social and emotional benefits of things like after school sports and activities, or even school itself, a visit to grandma's house, against the physical health concerns? What do you advise us to consider when making those decisions? Eleanor, if you'll take that one.
Yeah, so I think these are hard, and they are affected by every family's risk benefit calculus, right? And families have different risk benefit calculuses depending on their risk aversion, but also depending on their specific family issues, right? And including their family medical issues, right? And so I think everybody has to sort of understand that. And I think the key here is to sort of try to make a rational decision based on what you know of the risk and benefit, and then explain your decisions to other people without judgment, right? To say, this is the choice that I'm making for my family. Your choice might be different, and that's your thing, right? And so I think what I would say, first of all, is outside is always the gold standard, right? So I have no concerns about letting kids ski, run around in the snow, or be outdoors, because everything we know about viral transmission suggests that that makes a huge difference, right? And I think for other things, again, you have to sort of think about this. How do I feel right now, January of 2022, about a bunch of kids playing basketball together, like all sweaty and masks falling off and on top of each other? Not so great. How do I feel about kids playing tennis indoors in January of 2022, standing on opposite ends of the tennis court, hitting a ball with a mask on? Pretty good, honestly, right? So I think you have to sort of pick and choose. And then I think you have to be respectful. And I personally have 2 over 18-year-old children who are, at this moment somewhere in my house. And they are grown-ups, sort of, so they get to make their own decisions, right? And I can explain to them what I see on a daily basis and the importance of me for staying healthy, partly because I like not to get COVID for all the reasons Mark explained, and also because I have patients who are depending on my presence. And they have to make their own choices, right? My dad, who is not young, said, well, let's have dinner this weekend. And I said, let's not. Let's get together indoors with masks so you can see the kids. But my young adults, I think, lead a life that is pretty cautious compared to other folks, but not cautious enough for my 87-year-old dad and his, pulmonary issues. So I think you have to try, everybody's got to try to figure out how to walk that line. I'm not telling my kids not to see their friends, right? But I'm also not having them have pizza with my dad.
Mark, from a medical perspective, what do you see in terms of these social, emotional choices that we're making?
Well, I think it's this new era where things that were completely intuitive about yes and no decisions suddenly, like Eleanor's implying, have to be thought about. But there's some fundamental things. There's some sort of fundamental kind of rules that are helpful, and Eleanor's highlighted the very important individualistic ones where panels can go overboard with sort of stipulating things for everybody, whereas each individual family have to make these risk assessments for themselves. And secondly, that the set of things that we can do, which actually Eleanor was alluding to, and I'd add on vaccination status as well, whether you wear a mask or not, how you're going to be social distanced, do have to become for us like when our kids go out and play and say, when you're crossing the roads, please look both ways, make sure it's completely clear before you cross the road. We never had sessions like this discussing the absolute countless numbers of risks that we educate our children about, and which we romanticize with bears teaching which type of fruit a little baby bear can eat. Those have been ramified now manyfold by the presence of COVID, but we are used to doing that with children, our children, and with others' children, to guide them to sort of safer living. And number one is vaccination status, and number two is mask wearing indoors, and number three is hand washing, and number four is kind of keeping your distance when you don't have a mask on, and so forth. They're not intrinsically much more complicated than saying, it's easier to ride a bicycle if you get some momentum going, because when you're slower, you wobble and tend to fall off, because if they wobble and fall off, they're going to injure themselves. So I think there's some core things added to the individual things that Eleanor said that are really actually as straightforward as telling kids not to do drugs and not to smoke. I mean, we take that for granted that we're going to tell our children that, but what we're adding on a few more than that to help make the decisions both for them and for them to make good decisions wherever they are.
So especially on a cold day like this, a lot of those rules and really good guidance that we give our children means that many of them are staying inside, staring at a screen today on this vacation day and many other days throughout, in terms of after school activities. Say somebody was a basketball player and they loved basketball, and now they're not doing basketball, and so they're doing gaming. Parents have some concerns about screen time usage. Is there any gold standard on thinking about the impact of increased screen time on children's development?
So I'll jump in on that. I don't know if there's a gold standard, but recently I attended a grand rounds at Longwood in which one of the psychiatrists who studies this from Cambridge Health Alliance presented some interesting data that people might want to know. And it was mostly about social media. And parents will probably nod when they hear this, but she said that between 8 and 12-year-olds, 40% have smartphones at this point. Don't let your kids hear this if they don't. And in 2019, 84 to 95% of teens had smartphones. And the idea is that the estimates have gone up. Teenagers are spending the equivalent of 40 days a year out of 365 on their phones. The data is not all bad. So one way, the good news here is that teens are increasing their connections with each other and bonding. And it seems there's some real advantage, especially because, as Michelle, you say, they can't get together. And so that's the advantage. There's some bad things that parents really have to be careful. Cyberbullying is real. And now one of the new thing is online dares. So there's this whole thing with dares about things like how long can you hold your breath. There are some problems with internet addictions. And there's also much scarier things that happen, buying pills or meeting strangers online. So it really runs the gamut. And, the standard advice is you really do have to know what your kids are doing. But it's not all bad. And we're going to see probably increases of being on connection, certainly for teenagers.
Yeah. Anybody else have anything to add about screen time?
I mean, I think I would add, it's not so much screen time as social media, right? Is that, pre-pandemic, we had real life and social media sort of coexisting, right? And as our real life social interactions go down and social media goes up, that means the power of social media goes up. And I think there is this very real risk that, again, particularly for adolescents and young 20s, that the sort of very curated social media appearance of how everybody looks and how happy they are becomes reality, right? So if all you see is somebody's Instagram post and you don't see them on their like bad hair day, then you begin to think that that's reality. And that increases for kids who are struggling the sort of negative thoughts of the fact that my life doesn't look like her Instagram posts. And the reality is her life doesn't look like her Instagram posts either, but nobody's talking about that.
Is there, other than talking about it with our children and grandchildren, is there a strategy for helping kids through that?
I think normalizing it, talking about it, it's sort of been like a little intriguing pop culture trend of celebrities posting unfiltered photos, which is actually, I think, great to counteract that, and reminding people that what you see on social media is really curated and not reality.
Thank you.
I was going to add to all these great points is this point about listening to your children. So we are, like has been mentioned before, what has happened in the last 2 years is an extension of what had been happening for the previous 10 years. And maybe it's highlighted some things to us that were going on, but listening to one's children and learning from one's children about the world that we are emerging into. And I think, Eleanor, if I can borrow that your 11-year-old kid's story, it's that the kids know better what is going on in their world than we do. And that's always been the case. My parents didn't have a clue what we were doing when we were children, not one clue. And in fact, even at this stage, when I tell them when I tell my dad what we were up to, he cannot believe it. And the truth is, it's the same now as it was then. There's no change in adult-child relations. And so listening to children and understand what the modern world, and I'm talking about 21st century world, is that they're living in, help us to guide them. Screening that out for us and just seeing it as mystifying will not help us to help our children.
Thank you so much, Mark.
There's also a quick fix here, by the way, that might seem radical. That's not screens, but magazines. One of the things is cut down the number of fashion magazines that come into your house. There's some good data on the more fashion magazines that people have coming in, the lower self-esteem and feelings about body image in girls, tweens, and teenagers. So cut your subscription.
Thank you,
just
Steve.
Add a perspective as someone who has 2 6th graders and a 9th grader on the panel. So I think there's 2 ways I've had to sort of reframe my thinking, like, oh, my kids are still on their phone, they're still on their phone. But like when I was 10, 11, 12, 13, I would be talking on the phone with my friends for like 4 hours straight. And I sort of have had to reframe it in the like, FaceTime and online games are the way that my kids talk on the phone with their friends for 4 hours. So if my daughter's on FaceTime with her friend in her room for an hour, that's like no different than what I do when I was 11. We just didn't have the technology to see the other person. And then the other thing is just knowing, and I think a lot of parents know this, and you can get recommendations from friends and, you know, people with kids, your own kids' ages. There are a lot of good programs and apps that allow you to sort of keep track of your kids' screen time and social media. And it's not about policing them, and it's not about spying on them. It's about knowing that they're where they're supposed to be and they're safe, right? Like we have a 2 full-time employed parent household. We rely on carpools to get my kids safely to where they're supposed to be, masked, hopefully. But I need to know that if I'm in the ER until midnight, that my kid shows up at swim practice when he's supposed to be at practice. And it's not about not trusting him. It's about making sure that the people who are supposed to be getting him places are doing that appropriately. So I don't think that those apps are inappropriate. I think that they're a necessary part of today's society.
Right. And again, I would say, I think to sort of echo what Mark said, the key here is to communicate about it. So I have among my own personal pool of children, some whose location is known to me through the miracles of technology, and some who feel that that is overly intrusive and are not willing to participate in that. And that's okay. Like, honestly, with me as a parent, we have had conversations about it, and he's not in 6th grade. So, you know, if he can join the army, he doesn't need for me, his mom to know where he is his theory. And I, you know, have to respect that. I think the real issue here is what Mark said, is listening and opening the conversation. So if somebody says to you, you know, this is miserable, I can't believe I'm like stuck at home this whole weekend in the cold, instead of saying to them, well, why don't you go like get a book? Or, you know, do you know how lucky you are? You know how many patients I have who are in the hospital with COVID, right? Like, there are all these responses that are sort of knee-jerk responses that really cut off our kids' attempt to express their emotions, right? And so what we really want to do when somebody says that is to sort of use active listening and to reflect back to them and say, like, you're right. This is kind of miserable. It's freezing cold out and we don't have a lot to do. Stop and then listen and see what they say back.
That is just such helpful and timeless advice. We received some questions in advance, actually multiple questions about masking and childhood development among the early ages. And one of them was, are there ramifications for children who have diagnoses such as social skills challenges or speech delays or hearing loss? Another question asked it in terms of how do we envision children growing up with sort of normal social skills with a lack of facial recognition from peers, teachers, and adults? How do we understand social emotional development and the mental health of that younger age set who didn't get a chance to read faces as they're now seeing the people they're interacting with masked? Eleanor, if you'll.
Yeah, so I think I'm actually not, this is one where I'm not so worried about the general public. So I think most, you know, little kids are still getting enough time in a home setting where people aren't masked, that they're very good at learning to read faces. And we're all sort of, you know, biologically pre-programmed, right, to recognize the distribution of a face. And so biology is helping us. And I think most young children are getting enough of that. I have been impressed with in the office, where I am always masked and always wearing eye protection, the ability of young children to still read my voice and facial expression, and to sort of play with me and engage with peekaboo and all of those things that are normal developmental milestones. And I think, do I maybe sometimes exaggerate the tones of my voice? Yeah, probably, because I'm making up for it. But I have not noticed any lack of social engagement with me, even though I'm fully masked and gowned. I think if you have a child who has special learning needs, and in particular, children with hearing loss, that's a completely different situation. Those kids are really struggling with the masks. And I would encourage parents to talk to your pediatrician and your audiologist about how to best advocate for your child, because those children are in a remarkably difficult situation.
Thank you. Well, speaking about difficult situations, can I pivot for a moment to some questions that we got from families with children under the age of 5, right? We received questions like, what advice do you have for us about when our children will be vaccinated? How do we conduct our lives now, given that our children cannot be vaccinated, and how do we help them and ourselves with our own mental health stability? So Mark, on the when, I'm going to tag you in.
Yeah, well, obviously, Israel just, I think just recently was starting vaccinating kids under the age of 5, and will give us, data and readout on, safety and efficacy in that context. So I think in a very practical level, every level of vaccine, approval has to occur in an informed way, where safety is the first foremost thing with all vaccine deployment. Is it safe? And so we have to be sure that it's safe before we can approve it. I think just from a point of view, is once it's determined as safe, it should be used like vaccines are used currently in little children. I'm not a pediatrician, but I do know the programs of vaccination that go on in children that prevent a great deal of disease, and very important, otherwise potentially serious diseases. And I'd hope that would occur relatively soon. With regards to managing the fact that your child is not vaccinated, it is in that constellation of managing risk that Eleanor talked about. You have to make your decisions based on that. And I have colleagues at work who have young children, and their children are not well. They have to make their decisions about how they're going to manage them with daycare. And I'm fortunate to work with an employee like the hospital employee, where we can balance between virtual work and staying at home doing virtual work and coming into work. So, but it's difficult to pronounce for all families what you have to do if you've got an unvaccinated child in your midst.
But I would say that the Department of Secondary Education and the Commonwealth of Massachusetts have done a really remarkable job of putting out published guidelines for what people can and can't do when they're exposed or not exposed, or vaccinated or not vaccinated. The goal of which I think DPH and every pediatrician in the universe agree with, which is that by and large, children belong in school. And that's where they learn best. That's what's appropriate for them. And so if at all possible, again, safety is paramount, but children belong in school, in-person learning. And that is true all the way up through, at the very least, college graduation.
Yeah, so there's actually, you've hit on something that's been in the Q&A. There's a lot of frustration about, sure, I'm all with you. Thank you, panelists and esteemed doctors, for guiding us on individual choices. But my kid, our family, can't make an individual choice because the school is closed, the daycare is closed, the after-school activities aren't running in the way. They're not getting the opportunity. The colleges are remote. They're not getting the opportunity to make the choices that they perhaps would be willing to take some medical risk for. What do you have to say to those who have commented that in the Q&A, and to families like them who feel their own mental health challenged by the constraints that their children are facing?
I mean, I think this is really hard, right? I mean, for the last 2 years, I've basically spent every single spare waking moment of my life helping to keep schools open in person and developing protocols. And I think it's really hard at an individual family level if they're willing to accept some level of risk and the school is not, in sync with that. And I think we're all trying to do the best we can, and the Department of Education messaging can be a little confusing, and every school is, I think, interpreting some of the rules a little bit differently. Some schools are doing this way, and my kid's school is not doing that, and I don't understand. And I think one thing parents really need to understand is that when we're making these policies at a school level, like my job and the job of other people who are doing this is to try to balance that need to keep as many people in school as possible at all times, but also to keep the kids safe and healthy. Like, I'm a pediatrician. Anything I ever do in my whole life is to keep kids safe and healthy. And so it's a hard balance. And sometimes that balance is going to work for some families and not for others. And some families might love that rule. No matter what protocol we make, there's always a handful of people that think it's not strict enough and a handful of people that think it's too strict. And it's like a game that you can't really win.
Yeah.
And so I would ask families to have a little bit of grace towards the school administrators and the teachers and the doctors and everyone who is trying to make this work for as many people as possible. And then just also to remember that no matter how you think about the rule or the protocol, I don't like to call it rules, the guidelines that we're making, like, our underlying goal is to keep children safe and healthy, like always. And I mean, if other people have ways that we can sort of balance that a little bit better, I'm always open, but it's not an easy task.
No.
Yeah.
I think Sabrina, you're absolutely right. It's always about the least worst option. So there's never a perfect. I think what's being highlighted here is, yes, the perfect thing would be that your kid could go back to school even if they had to wear a mask and socially distance, but the school's not open. Then you're left, with your least worst options. You can't even go for that. I think, and I think one of the, I'll add this, and I only mean it from my only personal experiences, to get involved with those schools that you're involved in as a parent. Now, you'll say, well, I'm a doctor, so when I got involved trying to help the schools that I've been involved with accomplish the mission of opening and keeping open with masks and vaccines and stuff like that, well, you're a doctor, they're going to listen to you. I actually think this is another aspect of what, as adults, we have to exercise our democratic and our free speech to talk to our schools about what they're doing and understand what their schools. I know some schools are challenged with labor shortages. COVID is not just impacting the children, it's impacting how many teachers are coming into work. And I think the participatory component of democracy has never been more important than in our schools, in our politics, in our healthcare, you name it. And I think this is another aspect where maybe COVID will encourage people to be more directly involved in setting the mission for the school, which is essentially what parents have to play a role in at this particular time, or if they can and if they feel able to. And I only mean that for certain parents who are willing to do that, but there is a role for parents in guiding their schools one way or another.
And following up on the idea of keeping kids safe and really democracy, I wanted to mention for parents and grandparents who have kids with special needs, that there have been special clinics. I know in December, one just happened in January. I think they'll continue to happen for kids who have real difficulty getting vaccinations. They have either their kids on the spectrum, their kids who have tactile issues or other mobility issues. And people should know, perhaps they do, you can speak to your pediatrician, or I think I put this on the resource sheet about where and when are there vaccination clinics where they have specially trained individuals to help out those kids and families.
And I would say also, again, probably your pediatrician knows your child the best in that way. And I have kids who I have vaccinated, like myself, sitting like in the corner of an exam room on the floor with like a child on my lap. So, I think most pediatricians are deeply, deeply committed to the idea of safely vaccinating everyone. And most of us will do pretty much anything we can to get your child vaccinated. So if you have concerns about your child's anxiety and or other needs that prevent them from getting vaccinated, please, please, please send a message or call your pediatrician. We absolutely will help you get this done.
Thank you so much. I want to shift for just a minute from the pandemic specifically into broader life issues. Last night, as our family was coming out of our beautiful Shabbat observance, got a text from someone immediately about the hostage situation at a synagogue in Texas. And there I was with my children sitting around just about ready for a conversation about, how wonderful our Shabbat was. And instead we are now speaking about terrifying realities of the world that we live in, and particularly the world we live in as Jews. And it really made me wonder about this question that I think of often with relation to the pandemic as well. What is the role of adult mental health on how we manage those sorts of moments, how we manage our own anxieties and depression and difficulties throughout this time on our children's mental health?
So there's a great opportunity here, I think, for parents to give kids a powerful message in a couple of ways. One of those is to talk about how it's difficult and frustrating and scary and whatever it is for them in a way that doesn't overwhelm the kids, but also makes it clear what reality is. And if appropriate, again, you have to know your kids and your family to let them know that you might be getting some help yourself. And in what form that might be, conversations with best friends or conversations with therapists, because you really model and give your kids a gift when you say, when you have difficulties, A, it's okay to talk about it, and B, you should do something about it. So I think it starts there with the message from parents.
I totally agree. I think there's a real opportunity to say, gee, it seems like you're struggling and I have struggled, right? That's a tremendous opening line. I would add that anxiety is contagious, just as contagious as COVID. And so if you are anxious and visibly anxious, if you are asking the same question over and over again, seeking reassurance, if you are checking things over and over and over again, if you are having trouble sleeping because of your anxiety, those are behaviors that other people in your house will pick up and model. And so it's important to look for those things in your family, but it's also important to look for those things in yourself. And if you feel like you're not the person you were 3 years ago, or you are having a hard time getting out of bed in the morning, then please call your primary care physician and say, hey, I feel like I'm not quite right. Almost every primary care physician I know will do those visits virtually. You don't have to leave your house, but there's support available. And you should know that if you're not willing to do it for yourself, you should know that those things are awfully contagious. And so if you won't do it for yourself, you should do it for your kids.
I just turn it couple of other little directions. Well, not little, but one is the central thing that the caregiver must pay attention to their own health to be able to be an effective caregiver. We're taught, even as a doctor, as we approach a person who's acutely ill in any shape or form, anywhere, we have to assess our situation first and our ability to deal with that situation. Right up the first thing, even before the ABCs, is, am I equipped to deal with this? So parents and caregivers must address their own healthcare and keep healthy and attend to their health. The second issue I would raise, and since there's a Temple Emmanuel, is that rising levels of anti-Semitism are affecting Jewish children. I have been stunned every year, and this has been a problem not just for the last 2 years, of the number of anti-Semitic attacks that my children have received while living in this country. And I'm not going to go on about it because this is not a forum on anti-Semitism, but it's brought up by the anxiety of the events in Texas. We must listen for our children's experiences of anti-Semitism in school and on the internet. I don't believe my children are exceptions to the rule. We're not, standout Jews in a way, but they have experienced it and have reported it. And because of my where I grew up, my parents listened to that. If the one thing they listened to that. So I'm just raising that as a health-related issue, mental health-related issue that Jewish children must be listened to about. And if the parents hear nothing, fine. But if there is something that needs to be addressed.
I just want to, Michelle, quickly, there's a really great question in the Q&A that I want to hit, which is kids who are transitioning out of college. And this is a potential, this is a group that I worry about a lot. I think the post-college graduation transition is one of the most challenging ones that people go through because it upends your social life, where you live geographically, and your sort of job, your academic life. And it does it for a lot of kids without a cohort, right? Because everybody sort of scatters in different directions, sometimes without a primary care doctor. And so I would say this is a real watch group for people transitioning. And in particular, for this generation, many of whom are looking at jobs that are virtual or partly virtual, I think you should really encourage them to make geographic choices that will put them in a supportive environment. So I have a patient who just got a job that's going to be entirely virtual in LA. And I kind of said to her, like, you can't move to LA. Like, you just can't. You don't know a single soul there. You cannot move across the country to an entirely virtual job in a place where you know no one. That is a setup for a mental health catastrophe. And so I think it's really, really important for these kids that you encourage them to make geographic and work and living situations that will prevent the social isolation that we know is a big trigger for mental health issues. And I can't speak for all the pediatricians in the universe, but I don't throw those kids out of my practice just because they turned 22. Like, you need another year, you need another year.
Wow. And Steve, you've spoken a lot to me in the past about workplace relationships and that water cooler moment that is being deprived for people. How do we help guide them with the lack of the water cooler for this generation?
So following up on what Eleanor just said, which I think is spot on, and to add to the problem a little bit, I would recommend to people, if you can get it, an article in last month's Boston Magazine called "Is This the End of Office Friendships?" And what they point out, and they reviewed some nice social science data, is how important those water cooler moments are, even in terms of how many thousand hours do you need to make an acquaintance, a best friend, or about a third of youngish people in their 20s and 30s meet their romantic partner at an office. And they point out things like, for example, if you're in an office and a meeting gets out 10 minutes early, chances are, if you don't have to run off to the bathroom, you sit around with Sabrina and Eleanor and Mark and you say, how are your kids? Hey, how did your golf weekend go? Whatever. And you do the things that build acquaintanceship towards friendship. Now, when Zoom meetings are over 10 minutes early, people click off. There's even an interesting biological aspect. When people are in physical proximity to each other, they talk about things like oxytocin, right, being released. It's not clear if that happens in a screen or not. And so the challenge, I think it's a great idea to really think, as Eleanor said, where you're moving. But there's an interesting challenge I see going towards some CEOs now. Should they, for example, require their employees to come back to work at a time when lots of employees are saying, you know, it's easier, of course, not to go in? And I think the decisions that are going to be made now are going to affect a generation in terms of their friendships. So again, it means if you're 20s and you're moving to a place that you don't know anybody, you're going to have to really think hard about what you're going to do and how you're going to do things like join Temple Emmanuel to meet other young people.
Amen on that plug. Thank you very much for that. Networks and having a network are so important in terms of maintaining our own mental health. I mean, everything we do as Jews is done in a minyan, in community. And at this time when community is either remote for so many or can feel inaccessible in this time of rising mental health challenges, as you've each outlined among our kids. As this continues on, what are each of you most concerned about and what are you most hopeful for? Can you leave us with a little Haftorah note of hope in each of your comments?
I'm most concerned about the ongoing mental health fallout of this. I think we're going to be dealing with a long haul of anxiety and depression and eating disorders in teens and adolescents. And I think as a society, we have to figure out a way to devote more resources to that, more outpatient programs, more access to therapists, and ways to help kids manage that. I'm hopeful in that I think in comparison to a year ago, when my college freshman had to move home because her university could not handle having, you know, students on campus for more than 2 or 3 months. She's going back next week. So that's a microcosm. I think the schools and universities in particular are in a much better place than they were a year ago. They have much more managed to find semi-realistic protocols that allow students to live and work together in person. And I think that is part of the road back to normalcy. So I'm heartened that universities and schools, I think, are doing a better job than they were a year ago of providing kids and adolescents with what they need.
Thank you. I'd like to go next.
I can go next. So this actually a little bit addresses one of the questions that popped up in the chat. Can you, my biggest concern, and I think this goes beyond like the actual effects of like COVID itself, is I think whether it's would have been inevitable with the increased use of social media and online presence, I think it's just realizing how little empathy there is in the world around us. And whether or not COVID ever goes away, I think learning this about other people and the way that people treat each other and just sort of the amount of selfishness that's out there, I think it's just really hard to kind of grasp. And, you know, I'll put in another plug for grace and kindness and trying to teach our kids those things. And I think teaching your children empathy now is no different than it's ever been. And I think modeling it is really important. I'm hopeful because I think I'm still at a stage where I'm surrounded by a lot of younger teens, tweens, kids, and I see that, you know, they have so much empathy and we just have to keep it there, right? Like children are born just inherently caring about other people. And I think we as a community, and like I see the way that my kids' schools and just their social circles and sports and things like that treat one another. And I think I'm hopeful that we have to make our voice louder than theirs. We just have to teach our kids how to teach others to be better. I don't know, but we can. I think we can. We just have to work really hard at it.
I think, again, it's fantastic. I've learned so much being on this panel. Sabrina, Stephen, Eleanor, it's such a privilege. As I say, I don't actually directly deal with the care of children other than my own. But I would say that what concerns me most is just like the loss of confidence in the human race's commonsensical, practical, intuitive approaches to dealing with the problems that we face every day, individually and for our families. That looking, and it sort of sounds almost like an upside down approach, just being on a panel, but just looking for being able to type a question into the internet to get the answer from some group of experts to work out what to do next when you're considering a decision. In fact, we are equipped ourselves with tremendous commonsensical, practical, and intuitive skills passed down from our parents and generation upon generation to make those sensible decisions. And it's always, I'm going to relate this story because there are other doctors here, but sometimes when you walk out of a hospital and it's full of problems that you're solving, you're amazed that people actually walk around on the streets outside the hospital perfectly well without coming up to you and going, what do I do next? Because people actually do have the confidence to work out with their children what to do next, and there are the help safety nets around. And I think getting away from common sense, practicality, and intuitive decision making is something that I worry about as we look to our phones and our TVs to tell us what we must do next. We can work that out for ourselves with the help of professional advisors who know our children best, like pediatricians. My optimism has always been with the children themselves. I work at times and guided troubled children who are wanting to come back and help and work. What I've seen over and over again is involving children in their solution and in the world's solution. And I hate to get corny, but President Kennedy's Peace Corps engaged people in solving, young people in solving the world's problems. And a lot of people that I know who were in the Peace Corps, I wasn't, I'm British originally, attest to the fact that that was one of the most important parts of their lives, that they were involved as young people, whether it's young teenagers or whatever, or older teenagers, in helping solve the problems of the world. I think that is what I'm optimistic about, because children show an interest in being part of the solution here, and always will be.
Steve?
So what I would say, I think both are summarized by watching David Muir at 6:30 in the evening. The first 20 minutes of the program are all the concerns that I have, and it's terrible. And what I've started to tell patients, and I encourage my medical colleagues, is to write this as a prescription, is no more than 10 minutes of news a day if you want to decrease anxiety. But watch the last 5 to 7 minutes of his show, because he always leaves it, as the rabbis know, with some uplift. There's always a story about somebody out there doing good for someone else, or businesses that are increasing in America. And I think we need those kind of uplifts. One other thing, I saw meta-analysis of studies comparing telehealth therapy with in-person therapy, and the telehealth appears about as good. And we do have that more available. We have to do advocacy to governments to increase mental health funding. We have to tell the insurance companies to keep this going beyond the pandemic. And there are a number of resources that we put in that sheet that gives people ideas of how they can reach out and get help. It really is sometimes slow and long distance running, but I encourage people, go to your pediatrician. They're the quarterbacks. Ask them who they use. If you're getting too long a waiting list, go back to them and ask them to help you.
Thank you so much. And Brian, if you'll repost that list into the side screen so that people can see it and take that away with them. I just want to say, last week our Parsha ended Midor Lador, and in every generation we are dealing with the frustrations, the challenges, the struggles, the fears, the real deep brokenness of our world. And today, I just have to, from the bottom of my heart, thank each of you. Thank you, Dr. Steve Broder, you, Dr. Eleanor Menzen, Dr. Mark Poznansky, and Dr. Sabrina Weinberg for just giving us our way, our push, our ooch through that wilderness, through the sea, and help us to emerge, God willing, on the other side. We've got a long journey to go. Our Parsha this week reminds us that just because you leave and the Red Sea has split and you've had a beautiful miracle doesn't mean you don't have to deal with the challenges of tomorrow. And I want to thank each of you for filling us with some concrete and practical ways that we can continue to deal with the challenges of tomorrow so we can invest in the most precious resources of tomorrow, our children. May God bless you all for being with us, for leading us, for guiding us, and may God bless each of you who have joined us today. Boker Tov. Bye.
Thank you.